to serve patients that were at one of the most vulnerable times of their life, their families and the patients. And in that role, that changed the trajectory of my life, both professionally and personally, because I later found myself needing those same services as my mom entered into hospice. And so that's where my passion for recruiting and my passion for purpose met. And I knew that I wanted to work in healthcare. And so fast forward, I found myself at Baylor Scott and White as a recruiter there. I ended up moving up there into doing more executive recruiting and leadership recruiting there, and then ended up back at the place where I was born at Parkland Hospital, and now here at JPS. And so it has been an amazing opportunity to join JPS and take that passion and use that passion here. I am a mother of 2 wonderful daughters and a wife. And I also, I have a passion and love for music. I sing as a professional artist, and I've had the opportunity to actually tour with Jeffrey Osborne, open for Frankie Beverly and Mays, and Lyle Levitt as well. With that being said, if I could sing this presentation today, I'd be a lot less nervous. But I will spare you of that today and share with you some of the amazing work that I've had the opportunity to do here at JPS with the talent acquisition team within less than, 2 years now. So we'll get started. I'll first start out with the labor market. When I joined JPS almost 2 years ago, I implemented and wanted to reimagine what talent acquisition looked like post-COVID, because we were trying to get our feet back under us. And with that being said, I wanted to implement a service excellence model, talent acquisition service excellence model. And with that being said, the market, understanding what the market is doing, even though we have some healthy numbers that you'll see, understanding what that market looks like is important. So when I built the strategy around how we were going to move forward, the things that I look at is our Texas RN vacancy rate. It's currently at 6.4% statewide. There's a high competition predicted for med-surg, behavioral health, and perioperative services. I also wanted to understand the growth market in the DFW area. We're slightly above at 1.3%. And then Texas RN, there's a deficit predicted from 12.5% to go up to 16.3%. There's also another area that I want to hone into, and that is our physician shortages, because all of that works together, and there's a projected a reach of a deficit of over 86,000. So with that being said, those are the things that my team and I look at as we build our strategy. And here's what we're doing to combat that, and we're driving excellence. We're focusing on the candidate experience. That's key to keeping a healthy workforce. We did that. We're focusing on that with actually driving timely communication, ensuring that we have an efficient process, and then a personalized approach. We also are using our new hire surveys to gather feedback to understand and keep a pulse on how candidates are feeling from the time they walk into the door and to the time that they apply for a position and walk into our doors. We know that that's tied to retention. With that being said, credibility and trust. This is one of the areas of opportunity we had here when I joined JPS 2 years ago, is delivering a consistent process, an efficient process, and getting our candidates through the process, the hiring process, as quickly as possible. We're leveraging technology like Text Us so that we can reach our applicants faster. We are also utilizing Calendly, a platform that allows applicants to self-schedule themselves. All of these things are driving our vacancy rates down and keeping us competitive in the market, because we know that if we have a great culture, if we don't get to them before the competition does, then they won't know it. So that was my focus. And then utilizing our metrics. Our metrics was really key, because the data and the details are important. So we are looking at, from the time an applicant applies to an application, how long is it taking for a recruiter to reach out to them? We've driven that down by 40%. that time to touch that candidate. And then we look at our phone screens. How long is it taking for us to schedule someone to schedule someone for an interview? And that we've decreased that down to about 79%. All of these things are helping us drive excellence and maintaining a healthy, stabilized workforce. And then our strategic partnerships, which is so important to me. It's key to building a pipeline for our future. We are tapped into our universities, our schools. We're also bringing the community into our organization so that they can feel and experience our culture through some of our fun events like the Nurse Hero Healthcare Bowl, where we had over 130 nurses show up to that event and tour our nursing units. That's how we're driving excellence. And now I'd like to share with you what results we're yielding through driving excellence. Our impact and our results. Some of the key data that I'd like to share with you is our RN vacancy rate. You saw that the Texas RN vacancy rate is well above 16%. Well, I am proud to say that our RN vacancy rate is below the national average at 5.66%. That is an amazing accomplishment for JPS and a healthy place to be. Thank you. The reason why I focus on this particular data is because RNs make up about 50% of our population, our workforce. And so it's key, and it's to stabilize and make sure that we keep an eye out on that. And then our average time to fill, again, that competitiveness, that's what we're focusing on. We're continuously driving down our time to fill. Last year, we ended in 2024 with about a rate of 64 days. It took 64 days, and we're drilling down. We're at 50 days now of time to fill. And that's close to the industry average at only 1 day above that. So we're doing great work there. And our jobs filled, less than 90 days. In the industry, 90 days is considered an aged rec. And so that's what we gauge. That's how we gauge how healthy and how fast we're getting our candidates through the door. We're at 88%. That's 10% up from last year. So all of those things that I discussed around driving excellence are contributing to these numbers. Our internal fill rate, we're at 21%. That's 4% above our year from last year. And what that tells us is that candidates our internal employees are feeling like there's job growth. They're connected to our culture and they want to stay. And so that's why we take a look, we keep our eyes on that internal fill rate. The candidate satisfaction, definitely tied to retention. If we know that industry says that if we can get someone onboarded and that experience is an amazing experience for them, then they're going to stay with us. And so we definitely want to make sure that all of our candidates are feeling welcomed and their onboarding for that first 90 days is a great experience. We're doing that with timely communication, follow-up, making them feel like it's a fair process, leveraging our relationships with our leaders so that they understand the importance of feedback quickly. And so that's how we are driving our excellence, and this is our outcomes. This is how we've made a difference, and we're going to continue to do that. One of the other ways that we are driving excellence is staying plugged into the stakeholders that we serve. We did targeted rounding as a team. Our talent acquisition, they're required to do that on an ongoing basis, but we did sit down with some of our leaders and get feedback. And we get a lot of feedback from them, but some of the feedback discussions we had were around workforce retention and development. We focused on the talent acquisition internal mobility process. That was something that we were launching, and we were able to share with them the why and how tracking that information would make us have us to be able to support them better. We heard some feedback around team morale and engagement. And one of the things that stood out to me the most and that I'm most proud of is our radiology and talent acquisition partnership. Yaya is a recruiter on that team, and she walks lock and step with them to ensure that they are getting their positions filled. We've done a lot of conversions in radiology that I'm proud of that saved us millions of dollars actually, that with nursing and with nursing and radiology combined, we've saved over about $2.8 million in savings just to getting conversions done. That means that people are choosing JPS. And so that was one of the partnerships and one of the feedback that I received during that rounding opportunity. And so going forward, what are we going to do going forward? We're going to continue to stay focused on the market. We know that the market is just like Texas weather. It could change at any given moment. And so while we are in a healthy place, we will not take that for granted, and we will continue to pipeline candidates, building relationships in our community. We will make sure that we leverage our exceptional workforce to stay competitive. That is our superpower. That's who we are, and that's what we're selling. We know that culture is something that money cannot buy, and so we are focusing on those candidates that have a heart of service, and that's in our conversations with screening. We also are going to continue to forecast by using data. We're going to focus on our retention and our growth by continue to streamline our processes and see how we can continue to improve. And we're going to continue to leverage technology with our new Infor, I'm excited about our Infor. It's going to change lives and shift us more closer into being strategic partners to our business. And so that's how we're driving excellence, and we will continue to drive excellence. Thank you for your time.
Any questions? Any questions, Corian?
That's good.
Yes, we are. We are currently involved with Fort Worth ISD. We go out and we're doing job readiness. Our recruiters are not only recruiting, but they are also volunteering to support. Actually, we have students come on board. We're focusing with the SHINE program, and we're going to be doing job readiness with them. So we definitely present and support and volunteer in our communities and our schools. Yes.
So we are not at this point, and in some ways I say yes and no. So we had a goal last year to connect with 1,000 students, and we exceeded that goal. We are actively engaged in their student career fairs. We're actively engaged in the O.D. Wyatt partnership through Healthcare Heroes. And so we're in close partnership with academic affairs, and then now the SHINE program. And so really it's about us looking to see how, based on the staff we have, how we augment it and how we scale that further. But we are involved in their recruitment fairs because they have local career fairs. And so that is how we have, in many respects, continued to anchor with them. We're also a partner with T3, which we know is an emerging force in education. And so we are connected in that way, but there is continued opportunity to kind of grow that footprint. I will tell you, we've had great partnerships with Fort Worth ISD. I think we have an opportunity to continue to grow as you think about like Crowley and some of these other districts that are not central to thinking about even parts of Arlington. So that's where we have an opportunity to expand to grow.
Recently posted some of our positions.
Yes, through T3.
Okay.
Good morning, and thank you for that question. I think there's about 12 actually school districts in Tarrant County. People don't understand how many school districts the region covers. And so with that, as Dr. Duncan mentioned, Fort Worth Mayor Maddie Parker has stood up an education council on workforce and education because we realize the needs to really ensure that we have a workforce for today and tomorrow. What does that pipeline training look like? We've been intentional at the high school level, but we also realize as a workforce, it has to start a lot earlier than that. And so with this group, it really is a convener of all your major industries, healthcare, hospitality, all your 4 major business corporations that come together to really identify what are the workforce needs and how we can partner as an education unit to meet those needs. And so as Dr. Duncan mentioned, quarterly, this group and actually monthly convenes to really just talk about what those best practices are, but also challenge us to ensure that we are working with our HR and our talent acquisition team to make sure that when they graduate that they have placement. But we also realize that some need certifications and trainings. And so what does that look like? Because and you think about in healthcare, people think about traditional ancillary careers. And so we know we have a lot of back office careers that can really meet those needs too as well. And so with that, we're looking at it as a really holistic approach. Ashley mentioned the SHINE program that we're really excited. Through the Office of the Governor, we received funding for that program, which will help our high school seniors. I think we only had 30 slots and we had over 700, almost nearly 700 applicants. So we realized that that is a need, that parents and students are identifying that they want this exposure and training earlier for their students as well. And so with that, we are looking and look forward to with outreach and with HR to really have a robust training program for that pipeline too as well.
Any other questions?
Thank you.
Thank you. Thank you.
And here I am having to do my report after that. Thanks, Maureen. No, thank you so much. All right. So I will get into kind of what's been going on in HR. And as you know, we do our people and culture in action where we kind of highlight the wonderful things that have been going on throughout HR at JPS. So we'll kick off with a little bit of insight on our 2025 Excellence Awards. As you all know, JPS every year awards 15 Excellence Awards to employees and a couple of leaders throughout the organization who really do exemplify the JPS vision, values, and purpose in action. And this year, we are excited to announce our 15 winners. We did what we call the Excellence Award Parade, which is where we go to the units and we surprise those award winners on their units by making them aware. And so this video will highlight just a little bit of that. So I will tell you, I made probably of the 15, I think 8 or 9, I was able to go to the actual unit. And when you hear the stories of these folks and what their colleagues are saying who recommended them, it literally brought tears to my eyes. So I really do encourage you all on July 29th, we'll have our Excellence Award. Typically the board members come and celebrate with us, and it's wonderful to hear the stories and the impact that folks are having. One of our nurses who won, they talked about how she really did help preserve folks' dignity as they were passing. And there was one particular story that they told about how a person was dying alone and how she said, y'all have to find somebody to cover because she can't die alone, and held her hand. And it is just heartrending to hear, but it made me so full of pride because our folks care in a different way than any place I've ever worked. And those Excellence Awards winners really did demonstrate why JPS is a phenomenal place to work, but also to receive care. Sure.
To shared with them, but just kind of what the criteria is and how how is that selected? Who selects?
Sure. So the criteria, we have a nomination form that comes out through our engagement site, and it basically asks you to, I think you have to be here, I think 2 years. Of course, you can't have any disciplinary action and all those things, and you're nominated by a peer. There is a guided prompt that basically asks you specific things that really helps in a narrative form to demonstrate that that person really does operate in alignment with the JPS values and vision. And so it's a pretty lengthy process. It's not something you can kind of just throw something down on the paper and get a nomination. We leverage a group of former Excellence Awards winners as our selection committee. We blind and redact any identifying information from those nominations, and they're all submitted during a window of time. They're then, we kind of go through them to make sure everybody's is complete, and then that interdisciplinary committee does blind scoring. And then we come back and make the final decision about the 15 winners. And I will tell you, it is a fierce competition because every year we typically have well over 100 nominations. And it is, you are really trying to dig into nuance to figure out who rises to the top. But it is by far JPS's best and brightest, and it's a wonderful recognition. So the other things we want to kind of highlight are the things that we've got going on. We shared with you all, I think recently, that we did publish a year in review. It is in the portal for you all. I think it was in the portal last month, and it's out there. For those who need a paper copy, we can get that to you as well. But it really does a good job of just highlighting all the things that are happening across HR for fiscal year 24 and sharing our impact. We want to do a better job of highlighting, not just for the HR committee, but for our workforce, all the work that goes into making workforce run and all the things we do to make sure that our employees have what they need to provide care to patients. And so that HR Year in Review does a great job of highlighting that. And we're really proud of the work that the entire HR and patient experience team did in fiscal year 24 to improve workforce and enhance the workplace environment. We have just published, and I have a copy for you all, I'll share it with you all, our second annual Healthy Flavors Cookbook. So the Enliven team, which is our JPS wellness team, every 2 years partners with the YMCA to provide our employees with a free cookbook, both in print and digital, that helps them to have access to nutritious and easy to make recipes. So as we were doing our wellness rounding over the years, what we've heard from our employees is that we spend a lot of time caring for others, not so much for ourselves, right? And so what our employees said they needed to be healthier was access to healthy recipes that are not fussy. And so this cookbook does a great job of giving recipes. We also make it fun, so we have some healthy competition. So some of these recipes were submitted by our own employees. They submit their recipes, and we select, I think, 5 to 7 of them to be featured in the cookbook. So this is a great way to connect. We also do live cooking demonstrations throughout the year from the cookbook. So we demonstrate how easy it is. And it's just a wonderful way to remind our employees that health is accessible, that we're making it something that they can get to pretty easily. So we'll share that with you as well. We're proud of it. So we actually have, so. We do not have samples, but I will make sure you're invited to the next cooking demonstration because there are samples. But we have an Enliven Ambassador program where we have over 400 folks that have agreed to be champions of health and wellness. And so we have a group of them that are part of the, again, interdisciplinary selection committee, and we blind the recipes. We're serious about blinding around here. We don't want any favoritism going on. So we blind the recipes. We have a scoring rubric. I actually was a part of that this year. And so that's how we select those recipes. And the people who win, I think they get a little certificate to like one of those healthy eating things, which will send you a box. So it's bragging rights and a box of healthy meals. But our employees are happy to participate. All right, we are on the move as it relates to really listening actively. People ask me all the time, like, well, how do we get to the 97th percentile in engagement? And I really do attribute it to the fact that we listen to our employees and we act on what they're asking for. And so over the last couple of years, we've heard a call for two things, and I'm proud to say we've delivered on that this year. We were asked to really expand our learning programs so that they are accessible to all of our employees, 24/7 access to learning. And so I'm proud to share that we've launched over 600 e-learning courses in a myriad of topics. We have everything from micro learning, how to learn a skill in, 5 minutes, to what we call PACE modules, which helps you learn some big complex skill module by module. But this is now available free of charge on JPS Learn to all of our employees, and they can access it. We also have trained our HR business partners so that when we run into a leadership challenge or there's a skill gap, we can then direct our employees and sometimes leaders to a training that will really help support them in growth and development. So we're really excited about it, and we've got really good feedback. We're also enhancing our tuition reimbursement program. So we're in partnership with Tuition.io, and now we've got a partnership where we've capped tuition for certain universities and certain programs. So we continue to find new ways to make education, career development, and growth and career mobility more accessible to our employees. The other thing that I'm happy to share is that when I came here, one of the first things I did was all of our services, I called them and acted like an employee just to see what was happening. And I called the EAP and they put me on hold. And I hung up and called again and they put me on hold. And I hung up with them and called my executive director of Total Rewards and said, we are firing them because they are not providing the service that they need to. We've got employees dealing with heavy stuff, and they need access to on-site EAP as well as wraparound. I'm so proud to share that April 1st, we launched a full wraparound EAP. We were able to go to RFP and get a vendor, Alliance Work Partners, that has so much more to offer our employees. You all know that mental wellness and resilience is one of the main battlefields in healthcare and in workforce. We have a lot more pressure. Quite frankly, the generations in the workforce react to that differently. And so one of the things that I continue to see with particularly millennials and Generation Z is that they want to know, as a part of their recruiting, what we provide in terms of support to help them deal with life issues. And so Alliance Work Partners is one more solution for us. It includes counseling. The phones are answered by licensed counselors, so you're not getting a switchboard and getting, put in, purgatory. You're getting to someone right away. We have a safe ride program where if you go out, you feel unsafe, you feel like you've had too much to drink, you can actually call that program. They can get you connected with like Uber and reimburse you for that. And then a robust around financial support and all other kinds of life issues, elder care for both employees and their families. So we're really excited about that addition to the EAP portfolio. All right.
Didn't you access that?
All of the time. And for this service, you can get up to 6 counseling sessions for one issue. And so that's not through your insurance, that's through the EAP. And then if you still need counseling, we've partnered with them where they actually will work to refer you to someone who is in our network so that you can continue to see somebody. But I will tell you, we have on-site EAP and they are booked solid all the time. And so people are utilizing those services readily. I agree, Dr. Lord, Reverend Emerson. I wanted to say Dr. Duncan, but Reverend Emerson. You'll take the doctor title. I'm just happy to see that in healthcare, we're destigmatizing mental health for the first time for ourselves. And I've seen, since I've been working in healthcare, it's really people are seeing it as a way to stay proactively fit, and that's a good thing. All right, so we gave you a teaser last HR committee and told you that we had made the announcements for our Rose Awards. If you all remember, Rose Awards is recognizing survey excellence. So those are the folks who have had exceptional employee experience scores and exceptional patient experience scores. And we, if you all recall, last time we had let the leaders know, but we had not gone to the unit. So we could not tell you all who won. So I'm proud to announce that we had Health Connect Clinic, which is at 1400 J-Pop, as a winner. That unit is led by Cheryl DeLeon, and so they were a winner. We also had Healing Wings, which is our HIV/AIDS Center primary care, led by Ryan Lamb, who was recognized. And then last but certainly not least, the Local Commitment Alternative is a two-time winner. So they won both 2024 and 2025 highest scores across patient experience over in behavioral health, and that is led by Kakita Edwards. So we want to say congratulations to them and give them some love for knocking it out of the park on the patient and the employee side. All right, moving on to our strategic updates. So I always start my strategic updates with our strategic roadmap because I want to keep at the forefront what we've committed to do here at JPS. As you know, in HR, everything we do is anchored to the organizational strategy of access, financial sustainability, and be the best place to work, learn, and practice medicine. This HR committee, I'm really going to focus on HCM technology and analytics to really highlight the work that we're doing around M4. And so I'll share a little bit about that. So Dr. Duncan challenged me the other day when I was talking to her. She said, I need you to make M4 plain for people because M4 is this big thing. But what, like for a layperson, what does that actually mean? And so Dr. Duncan challenge accepted. I actually went home and pondered about that. And I thought to myself, you know, you're right. We talking all these terms, but like at the core, what is M4 and what does it mean for HR? So really, M4 is a software that acts as the brains and the backbone of the hospital's operations. So think about Epic being the brains and the bones of an electronic health record. M4 is the operational version of that. And so it allows us to bring together data for finance, supply chain, and healthcare and HR all in one place, and it sits up in the cloud. And so instead of using a bunch of different clunky systems that don't talk to each other, M4 puts everything you need to run the organization from an HR, supply chain, and finance perspective in one smart connected system. And why that matters is because we really do have an opportunity now with the M4 implementation over the next year to build a command center, the virtual command center that allows us to have workflows that are predictable and that are standard. It allows us to have reporting and access to data to make data-informed decisions without having to run stuff into spreadsheets and using pivot tables and, quite frankly, having vulnerability to human error. It allows for leaders to be able to pull their reporting and set up reports to be sent to themselves as well as HR. But the thing that I'm most excited about, aside from the automated workflows, is that it's going to free up the HR team to really focus on the things in workforce that really drive engagement, drive retention. So many times our HR people are bogged down with the paperwork. This will alleviate some of that paperwork and let us get out into the units more, out to the business more active intervention. It also makes answers available to employees and leaders real time. So one of the opportunities that we have is around self-service, right? We don't really have self-service in the form that you think of for other things. You think about when you go on Southwest to book an airline ticket. You can go in and change your ticket yourself and you don't have to call a number. Well, at JPS, that doesn't exist. And so M4 will give us the ability to have some of that, where people can go in and look at something and make a decision or change something, and they can do it on their own without having to contact another human. They can also seek help directly from that platform and somebody can follow up with them. So it really is going to make information and processes be at folks' fingertips. It's going to allow them to do things at their own time. They don't have to try to, if you're on nights, you don't have to schedule to come in the middle of the day to be at HR. You can do much of that electronically. So we're really excited about that journey. It's a 12 to 18 month journey. This week, my team has been in meetings all week in the design phase. So this is the part where we get to design what we need based on the processes. And then we will continue to work with our implementation partners and our IT partners to make sure that we are what we're calling system aligned and that we have, system synergy, so that at the end of this, we have a product that we can really, really be proud of and that will really help us accelerate the things that we're doing in HR. Sure.
Brand new.
So I wouldn't say it's brand new because we're on what we call legacy Lawson. So M4 is the next generation of the Lawson product. So it's not completely new, but it is completely reimagined. So Lawson is the current HR platform that we have, and it is pretty aged and pretty clunky. And so over time, Lawson became M4. And so now the new version of the old Lawson is M4 and it's in the cloud. So it will do much more.
Is it radically different or?
There are similarities, but the functionality is radically different, just primarily because of the age. I mean, we can just do so much more in the cloud. It's real time. There's no, I'll give you an example. In our old system, when we put something in, it has to regenerate overnight. So you can't see it right then. People can't see it right then. In the cloud, the minute we put it in, it'll be there for everybody to see. So it's just, it's an evolution of the technology.
The HR component is one of several. Hospitals using all the components.
Yes, so many hospitals are using HR, supply chain, and finance, and that's what we will be using as well.
And will allow employees to select their benefits through it, what the benefit for.
So it will not, our benefit portal will stay where it is. M4 for benefits, if I'll be honest, is a little clunky. It doesn't have the same user experience. We've gotten to a really, really good user experience with our benefits partner. So it will integrate, that information will feed back into M4 so we can make database decisions, but we will continue to use what we call a UX. So just like a user design interface to make it easy for our employees.
But for payroll and record keeping,
It will all be in there.
all the things,
That's correct. It will.
you don't have to do it twice.
We will not have to do things twice. Thank the Lord. Any other questions about our technology journey? All right, let's keep moving. All right, so we committed, you all asked us for HR metrics, and so we committed to sharing those metrics with you all. And I would typically read from the screen, but I can't see that far. I'm about at the place where I'm needing readers, but I'm still holding out. So let me flip my page. So as you can see, overall turnover for the year is down quite a bit. We're at 8.10% for just overall employee in turnover for 25. Our nursing turnover is at 7.01%. Now, I will tell you, these numbers are not annualized. I tell people all the time, most of the turnover in healthcare happens after school's out. So when we bring this back in August, we'll see what it's looking like, but we are trending positively. And based on our annualized numbers, we are looking to beat our turnover for last year. I shared with you all last time that we felt like we needed to double down on nursing turnover and really work on a plan. And so Phyllis and I are in partnership to really hone into those areas in nursing where we can really impact early turnover, voluntary early turnover. And we are working together to craft a plan that will help us to move that down further. We talked about the 2-year goal really being getting to median. If you all know, at the bottom, there's our Saratoga benchmark. So they really do help us to gauge how we're performing against our colleagues. And so we are working toward getting to median over the next 2 years. So we continue to work on our turnover and continue to implement and look for new ways to make sure that we're getting in front of when we start to see, something's going wonky, that we're getting in those units and identifying how we can course correct quickly. Any questions about turnover?
All these numbers are through April.
Yes. Yes, through whenever we submitted the draft, which has been about 2 weeks ago. They always pull my graphs the day before we have to submit the deck, so I've got the latest and greatest, I believe. Yep. All right, I also want to share with you kind of our secondary goals. We have our AIP goals, but in order to meet those AIP goals, we set some secondary goals that really help us to keep focused on the things that really drive those AIP goals. And so this year we focused on making sure that we're improving the talent acquisition experience. We use a Net Promoter Score survey, which is Net Promoter Score is a national measure of whether people would recommend us. This year we set a goal to be at the 80th percentile or at 80%, with a target of 85 and stretch at 90. We're currently sitting at 89. We actually pull this metric every month. And so we are steadily increasing, but what we know is that, 1 month of slippage, one set of keeping our eye off the ball, and this number could change. So right now, 89% of the people who come through our candidate experience and take our survey highly recommend the experience they had. So Net Promoter, the way it works is you have to score at a 9 or a 10, very much like patient experience to get credit. So if you don't score at a 9 or a 10, it's considered what they call a detractor. So that's like you're not meeting your Net Promoter Score. Best practice and Net Promoter Score is 75 or above, but we've set that bar much higher because really candidate experience, in my mind, boils down to us treating people the right way and showing up the right way. So I feel like 75 is failing. If we were there, it'd be a starting place, but we want to see our Net Promoter score consistently up in the high 80s and low 90s. We also continue to look at reducing voluntary turnover under 1 year. So our threshold was set at 27.5, with stretch at 26.5, plus a reduction in nursing turnover under 1 year. Right now, we are beating target. And so we are doing good there, and we continue to work on that and continue to watch voluntary nursing turnover under 1 year. So stretch means that we've got to hit that number, plus we've got to see a reduction. And I don't actually have I'll find out what the percentage, but we've got to hit another percentage that is pointed to nursing only. So yes, for nurses under 1 year. So this is just voluntary turnover under 1 year. And so what I'm telling my team, because this is our internal goals, right? That in order to hit stretch, you can't just get that number. You got to get that number, and then we're going to drill down one level further and look at nursing. And if we've not decreased our nursing incomparably, then you won't hit stretch, even if you hit that number. Yeah. And then the other thing that we've really been working on in partnership with finance and operations is standing up our labor council committee. It really does help us to manage workforce in a way that really does align with best practice. So simply think about right people, right seat, right time, making sure that we're tracking all the internal movement. And so we are in the red in that. We had committed to 50% improvement in reporting and analysis, but we launched this project a little later in the year than we expected. We initially thought we would launch this project in February. We got feedback from the business and they said, we're not ready, we need more training. So we paused the launch. We then did manager and leader lunch and learn training to make sure that everybody understood the new process. And we didn't fully launch until March. And so we've got some catching up to do, but I'm confident that the new process is hardwired and that we are going to hit this goal, but we did get started a little later than we anticipated. And this is really around making sure that all of our transfers internally are captured through a requisition form so that we are able to actually understand what our career mobility looks like from a strategic perspective and, what our retention looks like, and we're able to actually track that. Previous to implementing this process, our transfer were paper. They were paper transfer forms. So when I was asking my team members, I need to see these metrics, somebody was behind the scenes, literally with stacks of papers, putting this stuff in a spreadsheet. And I said, no more, we've got to get this automated. And so now we have a process, had to train the business on the process, but we're really pleased with our ability to be able to make more data informed decisions.
Tell me what the numbers. 385, what was that?
So that's the number of transfers or status changes that are happening. And so think about a nurse that's on med-surg unit that wants to go to another unit or another department. There's an actual process. There's a status change process that has to happen. You don't just get to move. We got to move them in the system and move them to a new leader. Well, before that was done on paper, and there was no real way to track it other than manually plotting it into a spreadsheet. Now we've moved all those changes, all those status changes to the requisition process. So it's automated, it's captured, and we can make data informed decisions about movement. Before it was just kind of the wild, wild west, and people were diligent about it, but it was on paper. So there was not a real good way for us to say to the business, hey, a great example, turnover. If you've got a unit and the turnover rate looks positive, the engagement scores are questionable, but you keep getting these HR rumblings and you can't figure out what's going on. Well, when you start to look and dig in and you've got this data, you can figure out that people aren't leaving, they're just transferring out of the unit. Does that make sense? And so now this is one more data point where we can see what's going on and how we can support the business. And so before, if we had a mass exodus of employees, maybe they were transferring out of that unit into another unit, we couldn't see that, because it was on paper. Now we can say, okay, we looked at your retention, we looked at your, people are not leaving your department, or we're not leaving. We looked at your engagement scores, they're okay, they're not bad. But we're getting some complaints. So we're trying to figure out what's going on. We can go to this document and say, oh, people aren't leaving, but they are transferring out, and they're transferring out under X, Y, and Z unit. So now let's get in this unit and figure out what really is going on. So it's one more data point.
So, but as I look at these goals, bigger number, say you successfully process the treatment.
We've captured them because
And
we've,
the transfer may in fact be a sign of the problem.
well, now we can see it. Yeah, we can see it because before we didn't have a way to look at it. So now we're saying that of all the movements that happened, we want to capture 674, which was a robust number based on the paper forms. So we took the paper forms and said, how many of these did we have on paper? And so now we're going to look at how many of those are converting over from paper so that now we can track them. Does that make sense?
Yes, you're measuring, are you processing the transfers?
Yeah, process and adoption of the process is really what we're measuring.
Why are we having that?
So that's a whole nother set of goals that we are able to look into that now, but this really is just measuring the adoption of the process and consistency of process. Because remember, we're going from no process to process. So now we're like, okay, did the training work? Have people adopted it? Is anybody going around? Is there any folks that are going rogue on us? And this allows us to keep an eye on that based on the number of paper forms we had last year.
You weren't storing those paper forms in a cave somewhere.
They were not in a cave, they were in a file drawer. So we got one of those big accordion binders. We had to put it in there by date.
We're able to do this.
It will all be in M4 in the new situation. Yes, we'll be able to run that reporting. Mhm. Mhm.
It's and almost like sitting threshold of already past the before you stressed out, not being doesn't stand. Threshold after you stress stand. Oh,
Thank you, we appreciate it.
Yeah, I'm looking at this 90, I'm thinking, why not 90?
Well, I mean, yeah, so I was gonna say, our threshold is always set by what we achieved last year. So where we ended up last year, we start from there and move up from there. All right.
Trying to understand that.
Sure.
Workforce. Now, the reason your numbers got larger is you thought we was gonna have more people.
No, so when you look at 674, which was stretched, we looked at the number of transfers we had on paper last year. And we said, okay, if we had this many on paper last year, our goal is to get this many off paper in the coming year. Does that make sense? And so we took the volume. Yeah, we're measuring adoption of the process is what we're trying to do. Because we're trying to get it hardwired in the business and even in our own teams. I'll be honest. I mean, it was a training effort for our HR business partners because they're used to using the paper. And so part of it was even giving them the language and the scripting to maybe push back on a leader who is insisting we go outside of the process. And I'm like, we've still got to be partners, but we got to drive adoption. So that's really what this is doing. It's helping us keep our eye on hardwiring the process. Yep, yep. So we are looking at really those roles that are people requesting unbudgeted roles, people who may be requesting a role that they want to swap a role, right? So I had a HR business partner and now I want an HR manager. Well, there's additional costs for that. So part of what this does is help folks to lay out a business case for why they need to do that, tie that to core work, and drive visibility to their leader to make sure that they're supportive and that we're making good stewardship decisions about changing workforce. Again, so much of that has been kind of anecdotal and in a silo, and we're trying to bring consistency and fairness to it. And so Jill has been a phenomenal partner. Finance has been a phenomenal partner in coming together to create some rigor around our workforce planning so that we can start to make sure that we've got the right folks with the right skills in the right seats. Labor management councils.
It's always be evaluated whether you truly do need that.
Mm-hmm.
So the main stage, because you have to, because you doesn't show. the
Productivity doesn't show that.
Actually, for that.
So today it's Jill, myself, finance, and then one other person in HR that really helps with just keeping it all together. But what actually happens is that when we have these positions that are in question, we invite the leader to be a part of that conversation and share with us kind of what their business case is, what they need. And we're getting to the point where we're creating documents that they'll actually start to provide as a kind of proactively. And so it's an opportunity both to get feedback, but also to educate. Because I think we've kind of gotten in a habit where if it's a backfill, we just put it in. We're not really evaluating whether do we need this, do we need something else? Can we make a swap? Like, and so we're starting the process of that whole train of thought. Yep. Yep. It is, that's all it is. Yes, it is. That's the same. It's just a
Yeah.
remixed version of it.
Yeah,
Yep,
okay.
same thing.
I couldn't fill the position, had to go to FT committee.
Yeah.
I had to justify whether I could.
Yep,
fill it.
absolutely. Same thing. That's just a new fancy name. That's a 2025 name for it. Yep.
It really makes you as the requester justify whether I really need it.
Mhm.
Because I was one of those that it was mine, I'm gonna keep it. So I'm not giving it up. I mean, come on.
It's my position.
So no, so, yeah, it's just old recruiting. So now, look, Trent, the new name for labor, where unions is employee relations, or yes, so that's the new name for like if you've got, yeah, or labor relations. That's the new name for that.
Just gonna bring in every vascular surgeon. Operational financial. Here's cardiology.
The number of variables involved. Quite impressive. This is not one thing. There's tons and tons and tons. We got better storm. Across the line. You say, okay, that's JPS. You say, okay, what's our? Yeah. Look at all the reasons that that wouldn't be good. But that's.
Mhm.
It's, no.
It is. Thank you. I appreciate that. It's partnership. I wish I could say HR is the culprit, but really what has happened here at JPS is that it's been hardwired. Leaders get it, executive leaders get it, employees get it, and so we've created a flywheel. And so people are owning engagement actively, and that is really what makes engagement exceptional in the organization, that everybody understands that they have a part to play. Yeah. Yes.
Why is the legal counsel committee included in the transfer method?
So that they actually, we're actually the team that actually manages that. So this work is interdisciplinary. So like the requisition process change, that was the thought child of the Labor Council Committee. And really what we're trying to signal there is that this is not just an HR thing. We are all in lockstep. Operations is in lockstep. Finance is in lockstep. We are working in partnership to get where we need to be from a labor and productivity standpoint.
Is this committee approved the transfer?
So I wouldn't say approve because many of them are not ones that require approval, but if there is something that requires an incremental spend, then it would go through them for approval. But a lot of times it's just movement, like somebody's going from a PRN to a day. But I will give you an example. If I've got a full-time FTE and I want to move somebody to a PRN, the question becomes, do you get to keep that full-time or do you lose, you have to break that apart to 3? And so those are the kinds of questions that we're helping leaders to work through to really break down, here's your budgeted FTEs and here you can play within this space, provided that your productivity meets what it needs to be. But let us help you work through the best things to do to make sure that you stay within those guardrails. So it's partnership.
Assessing our labor needs for that firm workers committee.
Yeah, so they are a critical thought partner. JPS is leading this work, but they are the thought partner that we have with us to help. I got your back, Dr. Duncan. Yes, so they are our thought partner to really help us get into the units and figure out what's going on. We want to make sure that not only we have the right number of people, but we have the right skills deployed together so that we can create not only more efficient work, but happier employees. I can tell you, a nurse that's transporting a patient would probably be readily be more happier doing patient care. But if we don't have the right mix of techs and transporters with our nurses, then we don't have the benefit of doing that. So that's what Invigorate will do in support of us, is to help us to get to that. But it's going to be our responsibility to hardwire and to kind of build that as our new way of working here at JPS. Yeah. All right, I feel like I'm taking too long today. So you all asked several questions last HR committee, and I've got your answers. Uh-oh. Okay, all right, so you all asked a little bit about nurse residency. The question was that, what was the year-over-year increase in nurse residency program, and what are the retention metrics? So when you look at nurse residency over the last 3 fiscal years, essentially we've had we've had a percentage of people complete the program, and that same number of people stayed. So 85% of them in fiscal year 22 completed the program, and 85% of them stayed for 1 year. So when we looked at their retention 1 year later, they were all there. Now, the next step for this is that we're gonna look at 3-year retention, but today we've got 1 year retention. So what we see is that over the last 3 fiscal years, and of course, this is our year-to-date retention for fiscal year 24, because we don't have 12 months for those who graduated in 24. Every person who completed the program stayed with us at least a year. So the next goal is to look at 3rd year to say, are they staying 3 years and then 5 years? And that really helps us to understand how sticky nurse residency is. But by all stretches, it is a very sticky program, and people who complete it stay with us. So what it says nationally, Dr. Duncan, is that at 3 years, 60% of bedside nurses don't want to be at the bedside anymore. So if we keep them 3 years from residency, we have done better than most organizations. Where I think we have an opportunity to continue to double down is how we start to identify, for those who are getting restless, other opportunities within the organization. So we keep their clinical knowledge, but we start to look at other opportunities for them that could utilize their skill set, but maybe get them off the floor if they just don't want to be on the floor anymore. But 3 is the sweet spot. 5 is exceptional in this environment.
Saying, looking back at the last 3 fiscal years, every single nurse that graduated
Stayed at least 1 year. That is correct. Yep. And so this year we're on pace to do the same thing. Like I said, this metric for fiscal year 24 is year to date, so it's as of what it is today, but we will measure this again in September to see how it goes. It is. It's a good deal. Well, we do a lot to wrap our arms around our nurse residents. We're flexible with them. We assess whether they're in a good fit, and we will work with them. And so I think that really does make a difference. It's been a very successful program. So you all also asked how it's grown. So fiscal year 22, we had 104 nurse residents over 4 rotations. Fiscal year 23, 144, and then fiscal year 24, 170. Now I will tell you, we are at a much lower nurse vacancy rate than we have been in previous years. Like we shared, we're at 5.66%. We don't have any agency nurses in our building. And so each year we'll need to evaluate the class size that we need for our nurse residency to make sure that we have actual vacancy for those folks to go in and that we're not over hiring. And so, I want to share that we've grown year over year, but we've had a need. As we start to reduce nurse vacancy down really low, we will forecast to make sure we've got the right number of spots, because we don't want to ever have a situation where we've essentially overgrown our nurse residency program and kind of exceeded our need.
National invitations.
Yes, and I'm not the expert on that, so I will let Jill or Phyllis talk about our nurse residencies, but we're Pathway to Excellence for nurse residency.
We have an ANC species, yes.
So I'm not a
Pathways to practice.
pathways to practice. It's accredited. It's an accreditation.
It's actually with distinction,
Mhm.
so that's even a higher level than just accreditation. So there's only a handful of organizations across the country that have that distinction label.
Joe, you've been here since this whole kind of nurse residency started ramping up. Would you say this is the number one?
Absolutely. It's a great pipeline.
It is.
Students want to come to work at JPS. We're a level 1 trauma center teaching organization. They get to see a lot of things here at JPS. So we're, very attractive from that perspective. We always have more residents than we have spaces that we can accommodate. But to Ashley's point, Phyllis can chime in as well. We are doing really well post-COVID now. And so we may see where those numbers aren't needed to be this, huge number. We expanded because of our deficit with nursing, and we knew that it was a good pipeline. But it's an investment that we make in new nursing grads, because it is a program that they go through and we teach and we train and mentor versus having someone come in,
Ready to
with a
go.
lot of experience. But to Ashley's point, nurses have a lot of options these days too, the kind of careers they can go into. And so bedside nursing, on a inpatient unit, for their entire career is very rare. You don't see many. You see some in the hospital, but you don't see many.
So the STARS program, would you want to be, you need to be an RN if the environment?
So
Yes, if you're a registered nurse, you have to complete your program, your college program, then you also have to have your license before you start the program.
Yeah.
Well, in the 2007, let's say, what do you think the number of STARS is we have?
Probably about 30%.
Yeah. That's about what it was in 2009. We're just looking at each other blind.
Yeah.
Does anybody work here?
We have 0 nursing.
Zero agency.
That nurse, see, so that we see products for making the science stay.
As a new nurse, you love the education and the challenge that's here. You go within 6 months if you are ready.
Cut out.
It's either something about it, you love it, or you said, I'm not.
It's true.
That's the way it's exciting to be learning new things, residents, because after being here a couple of years, you're training them, so it's all exciting. But it's a lot of being here, what you can do, and the care that we can deliver that is needed. I worked at some places that I knew the patient needed some stuff, but the hospital wouldn't let you do it. That's not here, so that's a draw.
Yeah.
Okay.
Amongst this. Older. Said, they, big important part. Your focus, leadership, within John, neither one. Focus. Part work here, stay here. One employee, I said, it's not church. Is that person won't come out of church. We don't have you
It's also very rewarding that after you work your 6 months, the hospital could give you 2 years of training for experience. I'm just telling you, that's. Yeah. You are rewarded for working here, that they try to recruit you. You do 6 months here, they're willing to give you a year and a half. 2 years. And that means they hire you, give you an entry level hire. So we have all those competitions, all those to deal with. So it is a love of care that you deliver here and what you allow the nurse to be a part of. It isn't like, you know, you just come to be a, you are involved in defining that nursing care and being a part of something.
But
Okay, I'm good.
you're allowed to get now.
Yes, they.
All right, you all also asked for me to dive a little deeper into the utilization around our incentive services. If you all remember, incentive services is our rewards and recognition platform. And so when we look at, we break out kind of where we spend points at. You'll see to the far right, wows are really by far the bulk of our recognition. And what I think this is so cool about this, y'all, is wows are recognitions that carry no points. There are no points for wows. Wows are employee to employee recognition. You're awesome. Thank you so much for what you did. So when you look at all the recognitions that we give out, the overwhelming majority of them are just me telling you thank you for helping me out, which really does speak to our culture of engagement and owning that engagement. You also see, I'm going to actually move back from right to left. VIP values I promote is low, but it is powerful. Those are those leader-led kind of rewards and recognitions, and they carry 30 points. You've got special category, which is the next to the left, and special is really business-driven things. So think about the business unit who wants to recognize Employee of the Month. They can actually purchase points to be able to use in their own unit from their, they have dollars that are earmarked for engagement, and so they will make purchases to do nice things for the people on their units. Round of applause is pretty small. It is 10 points. And so that is a new category that we added last year, so you will not see numbers for fiscal year 23. High five is 5 points, which is just kind of a acknowledgement from a leader for doing a good job, real time. Then you've got e-cards, which is where we can recognize each other for birthdays or JPS anniversaries or whatever's going on. Birthdays, which is actually part of the engagement budget, and each employee does get a recognition on their birthday. And then last but certainly not least, we do a 6-month recognition as our part of our first year onboarding and orientation to, basically congratulate people for being with us for 6 months of service. Any questions about that? All right, and then last but certainly not least, I think it was you, Blake, asked about what our utilization numbers look like. And so basically what our utilization rates look like, if you go to the next slide, is that we have on average 50% utilization. So fiscal year 23, 50.31 of the points that were actually awarded were redeemed. And as a reminder, we don't pay for points until they get redeemed. So we give points, but you don't actually pay for them, and the employee, doesn't get taxed on them until they redeem them. And then this year, our utilization was slightly up at 57.96. So about 50% of the points that we give out actually get redeemed. And what we find is that we've got people who use every little point they get the minute they get it. And then we've got what we call affectionately point hoarders who are saving theirs for something big. And so they'll save theirs till they can get, a Southwest gift card or gift card to a shop that they want to go to. I know there's one employee that proudly touts that she saved her points for several years and bought a cruise, which was just the Carnival cruise ship gift card, so that is how our utilization looks. That is all I have today. Thank you all so much for your partnership. And unless you have other questions, I'll let y'all go. Thank you.
Okay, I don't have anything for closed session. So, thank you all, and we are.